Hi, everyone, and welcome to Your Healthy Dose. This is a podcast about current trends in healthcare, and I'm your host, Kym Douglas. Well, today we're going to learn about a disease that typically affects young adults between the ages of 20 and 50. It's a disease that attacks the nervous system called multiple sclerosis, or known as MS. Now, I have a very special doctor with me today from the Pacific Neuroscience Institute at St. John's, Dr. Barbar Giesser. She is internationally recognized as a clinician and an award-winning educator who is specialized in taking care of patients with MS. Welcome, Dr. Giesser. I'm so glad you're here with us today.
Thank you for inviting me, Kym.
Yes. So let's start at the top. What is MS and why does it affect women, I hear, more than men?
MS is widely considered to be one of a category of autoimmune diseases. There are a large number of these. And in an autoimmune disease, the immune system, which normally protects the person's own body or the self, gets the wrong message. It gets confused and it thinks part of the person's body is a foreign entity and its job is to attack foreign entities. In MS, the immune system has gotten confused and it thinks that the nervous system, specifically the brain, the spinal cord, and the optic nerves, are foreign, and the immune system furthermore gets the ability to get into the nervous system and starts attacking the nerves. For reasons that are not entirely clear, although it probably involves a combination of genetic influence and hormones, women are much more likely to get autoimmune diseases than men in general. So almost all autoimmune diseases are more common in women and men. In MS, the female-to-male ratio is roughly 3-1.
3-1. Okay, so let's also start with what are some of the symptoms?
So multiple sclerosis is very aptly named because it affects multiple parts of the central nervous system. So you could have a variety of symptoms. Common symptoms might be numbness or tingling. Actually, the most common symptom of MS is unusual fatigue. People could have visual symptoms. They may have trouble with balance. Of course, many other things can also cause the symptom. There isn't one specific symptom that only means MS.
And, I've found, and I'm sure you have too, all of a sudden it seems in the media, Selma Blair, I have a friend, Nancy Davis, there's so many women that are coming out with this, that they have been diagnosed with MS. So why is it important to detect and treat this as soon as possible?
I'm really glad you asked that question because MS is a very treatable disease. And the earlier that we can substantiate a diagnosis, we can get people started on very effective treatments that will help to reduce or stop future damage. And we know that people who get diagnosed and start treatment early on tend to do better overall.
Great. And are there any other symptoms that could develop than the ones you talked about?
The things that are likely to interfere with people's ability to live their lives would be trouble with walking or balance. Sometimes, unfortunately, cognitive impairment can occur as well, not inevitably. But again, that's why it's so important to try and get people started on treatment as early as we can.
How is MS diagnosed?
We don't have a single surefire drop-dead test to diagnose MS. We don't have something like a pregnancy test where you do it and it's either positive or negative. So we have rules, and the rules are that you have to have evidence of damage in the central nervous system, which is the brain, the spinal cord, and the optic nerves, in more than one place because it's multiple sclerosis. Either you have to have evidence that the damage occurred in more than one point in time, and you have to make sure that there aren't any other conditions that could account for the findings. As I said, many of the common MS symptoms can be due to a certain variety of other things. The laboratory modality that we always use when we think somebody might have MS is MRIs, magnetic resonance imaging. These are harmless, non-invasive ways of taking a picture of the brain and the spinal cord, and they can show us the areas of damage caused by the MS or the MS lesions. Sometimes, if we can't make a diagnosis just from the patient's history and exam and the MRI findings, we may want to do some electrical tests, which are called evoked potentials. They can tell us how well the nerves are conducting electricity. And sometimes we have to do a spinal tap to look at spinal fluid, which can show us certain proteins that may suggest MS. But other than MRIs, which should always be done in anybody who may be suspected of having MS, it may not always be necessary to do the other tests.
Right. And talk about the two main categories of treatment.
So there's actually three categories of treatment for what we would like to call optimal management of somebody who has MS. And the first would be pharmacologic treatment or disease-modifying therapy. So 30 years ago, the first disease-modifying therapies were introduced for MS, and these are medications that interfere with the immune system's ability to attack the nerves. So we're actually kind of getting at the underpinnings of this disease. Again, the first one was introduced 30 years ago. We now have almost 24. And so people have a lot of options, and it isn't a one-size-fits-all. Choosing a disease-modifying therapy is a very individual decision, and the patient and the healthcare provider try to make that decision together based on that individual patient's needs and history. So disease-modifying therapy is one of the first things we would do. Second category of treatment would be symptom management, because while the disease-modifying therapies are very effective in preventing future damage, they don't repair, they don't reverse anything that has already happened, and they don't treat symptoms. So we have other ways of treating symptoms. These may involve medication, physical therapy, other rehabilitative modalities that make people feel and function better. And the third pillar, if you will, of treatment are lifestyle practices.
Right. Let's get into lifestyle.
I've been working in the MS field for over 40 years, and what I find one of the most exciting developments is the emergence of evidence-based data that lifestyle practices are just as important in living your best life with MS as medication and traditional allopathic modalities. We're starting to get data that diet and exercise in particular are not only important in helping people to feel and function their best, we're starting even to get a little data, mostly in animal models, but also in some human trials, that they may actually have a beneficial effect on the nerves. So in terms of diet, there isn't a diet that will treat MS in the same way that a disease-modifying therapy will. In other words, we do not yet have data that any diet by itself will repair the nerves or stop future damage. Having said that, we are starting to collect data that people that follow healthier diets, and one very good example of that is the Mediterranean diet,
yes,
tend to have better neurologic outcomes. There are some studies that show they tend to have better MRI metrics. And so we encourage people to eat healthier type diets. In the case of the Mediterranean diet, this includes lots of colorful plants and vegetables, lots of good fats, or what we call unsaturated fats, which are the fats that you find in olives and nuts and seeds and avocados. We encourage lean proteins. Red meat is fine, but trim the fat off. Whole grains instead of refined grains. And the Mediterranean diet happens to include a little red wine. So we have some guidelines. Yeah. Again, that's one more specific type of diet. But basically, the main things that we tell people to try to emphasize are natural foods, not a lot of processed foods, not a lot of foods that have a lot of saturated fat in them, which are saturated fats are fats that are solid at room temperature, so that's butter and lard and the fat that you trim off meat and fried foods. It's kind of our typical Western diet.
I was going to say, I'm going to In-N-Out Burger after this. No, I won't.
Well, get the lettuce burger.
There you go. Absolutely. Thank you, doctor.
And whole grains and colorful plants.
Yeah. Sounds so good, and a good way to eat anyway, no matter what, right? So, Dr. Giesser, we talked about the Mediterranean diet and how important that is. Is there anything else like exercise? What about that?
That's a great question. And again, just to tell you how far we've evolved, when I was starting to do this 40 years ago, The conventional wisdom was that people with MS were told they shouldn't exercise, they shouldn't exert themselves, they shouldn't do anything. And I used to tell my trainees, if you could have picked the one worst thing we could have told them to do, that would have been it. We know, of course, that physical exercise has health benefits for everybody. It's also very beneficial for people with MS. We find that it can improve a number of symptoms such as fatigue and muscle tightness. We have a little bit of data from both animal and human models that it may actually improve cognition. It may help to prevent certain complications such as osteoporosis, and just makes people feel better. So we encourage everybody, and certainly our patients with MS, to get out there and move. And exercise can basically be anything that kind of gets large muscle groups moving. So you can walk on a treadmill, you can walk around the block, you can walk your dog, you can go dancing, you can do salsa, you can play frisbee with your kids. Unfortunately, housekeeping counts as exercise. Dancing is great exercise, and certainly some dancing is what we call a neuromotor exercise because you have to think about what you're doing while you're moving. So exercise is one of the very best ways that people with MS can keep themselves feeling well and functioning well.
Great advice. Now, talk about the approach that St. John's takes when treating patients that have MS.
So what we try to do at the MS clinic at the Pacific Neuroscience Institute at St. John's is we really try to take this comprehensive approach. We try to involve the patient as much as possible in the decision-making of their treatment plan, and we want to cover medication, lifestyle, which includes diet and exercise, rehabilitative modalities, and just living your best life.
Makes so much sense. Shifting gears a little bit, rumor has it that you were once a contestant on Jeopardy. I did my research, and I thought we'd do like a little kind of Jeopardy with you right now. And I hear you're really good. So let me shoot some questions at you. And these are frequently asked questions, and see if you're ready to go. You ready for this?
Sure.
Okay. So first question, is MS fatal?
Generally, no.
Okay.
No.
Good to know. Can MS be cured?
I think it depends how you define cure. I would define cure as completely stopping the disease process and then repairing the damage. When I was a medical student, there used to be a joke that the only thing a doctor can cure is pregnancy and a broken leg. And I don't think that's true. But right now, we're pretty good at almost stopping MS. We're not quite to the point where we can repair the damage, but that's the next great frontier of MS research, and that's where we're heading.
That's encouraging.
And again, I'd like to emphasize that just because MS isn't curable, and most things in medicine aren't curable, just because MS isn't curable doesn't mean it's treatable, and it's eminently treatable.
Does it reduce life expectancy, though?
Again, for the vast majority of patients, no.
Good to know. What causes MS symptoms, and how are they treated? I know we talked about this briefly.
So in order to understand how MS affects the body, it's helpful to think of the nervous system basically as a large bunch of electrical cables. And as we know, electrical cables are made up of wires, and they have an insulating material around them. The nervous system, the nerve wire is called the axon, and the insulating material is called myelin. One of the first things that gets attacked, that gets damaged to MS, is the myelin. So it's like you have a frayed wire, and the nerve does not get to efficiently conduct electrical and chemical signals. So, for example, if a muscle doesn't get the appropriate signal, the muscle may be weak. If visual pathways are affected, you might have trouble with vision. If there aren't appropriate sensory impulses conducted, you might have numbness. So that's what causes the symptoms, and that's why we try to get in and stop the damage as early as we can.
Okay, how about smoking and alcohol? Does that affect MS?
So if you asked me what the one single worst thing somebody with MS could do, it would be to smoke. We have data that smoking not only increases your risk for getting MS, but it also leads to a worse prognosis down the line. So one of the first things we tell people when they've been diagnosed is if you don't smoke, don't start. And if you do smoke, you have to quit. And we also know that, again, people who smoke and quit still have a chance to do better than people who keep smoking. There's no prohibition against alcohol per se. with the caveat that some people take medications that may interfere with alcohol, or alcohol may interfere with the medications. And I've had a number of patients tell me that sometimes after they develop MS, their tolerance for alcohol is diminished.
Interesting.
So, like everything, we say in moderation.
Absolutely. Can MS interfere with a woman's ability to get pregnant?
So the good news is no, MS does not impair a woman's fertility or her ability to carry a child or give birth to a child. Since most people who have MS statistically are young premenopausal women, reproductive concerns are very important in discussing when treating people with MS. And we certainly encourage people to have families if they want. And again, we've evolved. When I started out, unfortunately, the conventional wisdom was women were told that they shouldn't get pregnant. And we now know not only, of course, that they should and can, but that pregnancy is a very protected time for women with MS. This is kind of interesting. The most common form of MS is called the relapsing remitting form. People will get a relapse or an episode of neurologic symptoms, last for a few weeks or a few months, and then it goes away. And what we know is that during pregnancy, the relapse rate is much lower than before pregnancy. And there's a reason for this. We've said that MS is an autoimmune disease. The immune system kind of revved up and is attacking the nerves. In any woman who becomes pregnant, our immune systems are normally dialed down during pregnancy because a growing fetus has two sets of proteins, one from the mother and one from the father. And normally the woman's body would recognize the father's proteins as foreign. So if her immune system weren't dialed down, the baby would never be able to develop. So pregnancy is an immunomodulated state in all women. And for women with MS, this turns out to be a good thing.
Wow. How about this last one? Does MS affect your mental health?
MS certainly can and does bring up mental health issues. The prevalence of depression is greater in people with MS than general population. They're also more prone to anxiety. We think the depression is probably a combination of some of the damage caused to the nerves and some of the reaction to having a chronic, somewhat unpredictable illness. Certainly, people with MS who are depressed should certainly get help for this, and we would treat depression the way we would approach depression in somebody who didn't have MS, with a combination of therapy and medications if needed, lifestyle modifications. MS can also sometimes produce cognitive impairment, and we don't have any good pharmacologic treatments for that right now. But again, we encourage people to stay mentally and physically active. We know a lot about the benefits of physical exercise.
Well, I just want to say that you won the lightning round, and your prize is the mug from the St. John's Health Center Foundation.
Salud.
So there we go. You were so good. Thank you, doctor. So now let's talk about the history of MS. How has treating it evolved over time?
So there's actually a fascinating book about the history of MS written by a very great MS neurologist called T.J. Murray, and it's a very interesting book for anybody who wants to read about this. But MS, we think, was described as far back as the 14th century, and there's a lot of description of it in the 17th and 18th century. And in the 19th century, a very famous French neurologist called Charcot was actually the first person to make some systematic scientific descriptions of multiple sclerosis. He was French. He called it disséminé en plaques. And there's descriptions about treating MS with things like coffee and enemas and bleeding and things like that. I think we're a little more evolved. As I said, the big advance that's been made certainly during my career is the introduction of the disease-modifying therapies. And what I think is very exciting coming up in the 21st century is we're starting to get data about how to integrate lifestyle strategies into managing MS. And right now, we're just on the cusp, I think, of being able to have reparative strategies and neuroprotective strategies.
Oh, that's wonderful. And you kind of took my next question, which was, what does the future look like? And is there any other kind of innovation that's happening? And it sounds like that's part of it.
Again, the big frontier with MS research is trying to repair what's been damaged. And again, we've had some success in animal models, but newsflash, animals aren't people.
Yeah.
And unfortunately, things that work in a lot of animal models don't always work in people. But it gives us a proof of concept, and it gives us directions to go into.
Interesting. Now let's talk about you. You are so interesting and so wonderful to interview. How did you get involved with treating MS?
I was very lucky when I was doing my neurology residency, which was at the Albert Einstein College of Medicine in New York City. There was the site of the first MS Comprehensive Care Center, and it had been started and was supervised by a very famous MS neurologist named Dr. Leib Scheinberg. And I had a rotation through his clinic, and I always joked that he liked me because I'd managed not to kill any of his patients while I was in training. And when I graduated my residency, he offered me a job, and I knew I was going to be a neurologist, but I wasn't sure what field I wanted to go into. And I needed a job, and I thought, okay, I'll go work in the MS Center for a year or two. And I landed at the most wonderful place to train because I had this amazing mentor, and we had a team of extraordinary healthcare professionals. And I learned how to care for people with MS in the multiple senses of that word. So I kind of got into this by accident, but I was very lucky.
Yeah, divine appointment. Sounds like it was meant to be. And I hear you're also heading, we talked a little about this before we started, to Washington, D.C. to meet with legislators. So tell us a little bit about this upcoming trip.
So one of my other interests is advocacy, which I've been involved in for a number of years. And every year, our large professional organization, the American Academy of Neurology, has what they call Neurology on the Hill Day. And neurologists from all over the country go to Washington, and we schedule appointments to meet with our congressmen, our senators, and our representatives to try to educate them and usually ask for support for legislation that has impact for patients with neurologic disease, for neurologic research, and for the practice of neurology. So I'll be going up in a week or two. I don't know all of the legislation that we're going to talk about this year, but we almost always advocate for continued and increased funding for NIH, for neuroscience research. We'll probably be asking for streamlining of regulatory burdens. So, for example, getting authorization for people's medications, which is a very cumbersome process and sometimes denies patients access to care. Past efforts were instrumental in getting telehealth legislation passed, so we could do telehealth during the pandemic. So I think it's a great opportunity because legislators, unfortunately, sometimes may only see the financial costs of a bill, and we get to tell them what the human costs are.
I love it. Well, can't wait to hear how that goes. And I know you're going to be great out there. Now, before we close the show, I always like to ask who I'm interviewing if they have a takeaway, like our listeners and our viewers. If you had one thing that you just could tell them, what would the takeaway be?
Getting a diagnosis of MS doesn't mean that your plans for your life are on hold. MS is a treatable and controllable condition, and we encourage people to see their doctors and live their best lives with MS because we can give them the tools to do that.
Very encouraging. And for more information on multiple sclerosis, please visit the Pacific Neuroscience Institute website at www.pacificneuroscienceinstitute.org, correct?
Yes.
Yes. Well, unfortunately, that's about all the time we have. But again, you were great in that lightning round and great information here. Thank you so much for being with us today. And thank you to St. John's Health Center Foundation for making this podcast possible, and all the friends of the foundation for being supportive of us. We also want to thank all of you for joining us today. And I invite you to listen to our future podcasts because we have more medical experts like the doctor here. And they're all from St. John's, and they join us, and they're going to be joining us in the near future, telling us their special insights about so many important topics. And we talked about what a great thing this is just to give to the community and anyone who wants to know about healthcare, right?
I'm so excited that you and St. John's do this because I think one of the most important things that a healthcare organization can do is be a source of accurate information. So thank you for giving us the opportunity to spread what I hope was some good information information about MS.
Absolutely. And if any of you missed any previous episodes, you can visit yourhealthydose.org and you can see them all there. Until next time, I'm Kym Douglas with Your Healthy Dose.